So Children's Mercy is conducting a large vaccine clinic for those youngest kids. I do think we'll have a big rush based on our previous large-scale vaccine clinics when the vaccines first became available for teenagers, and then also those kids between 5 and 11 years of age. So I do think we'll have a big uptake initially, and my hope is that we can give vaccine to everybody who wants it. As we've looked at hospitalizations throughout the COVID-19 pandemic, things have really shifted. So in the very beginning, it was adults who were being hospitalized and getting sick and dying. And then in later kind of waves, we saw more teenagers. And now it has shifted entirely. And the majority of the hospitalizations that are occurring in those young children under 5 years of age. And if you think about it, that makes sense. They're the last group of people that we have not been able to protect with vaccine. I would give a strong recommendation to get the vaccine. We've had more than 2 million children under the age of 5 across our country have COVID-19 infection. And while this vaccine can't prevent all infections, it can prevent many infections, and it can prevent severe infections, hospitalization, and death. All of the vaccines we give ourselves throughout our lifespan is to prevent us from getting sick. Once you've gotten sick, the vaccine doesn't help that much, obviously. And so that's what I would tell parents is the whole reason we do this is to keep kids from getting sick in the first place. What's special about COVID-19 is that what we know now is that if you had a past infection and then you get vaccinated, you have better immunity than if you don't get vaccinated. And that's actually really important because you remember that this virus has changed throughout the pandemic, has continued to mutate. And so getting that boost from the vaccine is actually pretty important.